Lobotomy, once hailed as a revolutionary treatment for mental illness, was a barbaric practice that left countless lives shattered. The lobotomy, also known as leucotomy, was a neurosurgical procedure used to treat mental illnesses like schizophrenia, depression, and anxiety. This horrific procedure involved inserting an ice pick through the eye socket and into the brain, severing the prefrontal cortex with a mallet. It was quick, crude, and incredibly dangerous, with many patients experiencing seizures, coma, and even death. In this video, we'll delve into the origins of this controversial procedure, its devastating consequences, and the ethical considerations that were tragically disregarded. History of lobotomy. The world's first lobotomy was performed in 1935 by a Portuguese neurologist named Antonio Egas Moniz. His original method involved drilling holes into the skull and pumping absolute alcohol into the frontal cortex, essentially destroying brain tissue. The operation was deemed a success. He thought that damaging the connection between the front of the brain and other parts of the brain would stop abnormal behaviors and distressing thoughts. Later, Moniz began to use an instrument of his own design, called a leucotome, to remove chunks of tissue from the frontal lobes. Moniz was awarded the 1949 Nobel Prize for Physiology or Medicine for his discovery of the prefrontal lobotomy as a radical therapy for mental disorders. Within a year of Moniz's procedure, neurologist Walter Freeman and neurosurgeon James Watts performed the first prefrontal lobotomy in the United States. Although Freeman found this procedure great, he wanted to develop a procedure that would be faster, more effective, and require fewer resources and specialized tools. So, in 1946, 10 years after performing his first lobotomy in the US, Freeman developed a new method called the transorbital lobotomy. Instead of drilling into the skull to sever the connections in the frontal lobes, Freeman used a hammer to drive an ice pick into his patient's brains through their eye sockets. Once the ice pick was inside, he literally wiggled it around, severing the nerves connecting the prefrontal cortex to the thalamus. This adapted procedure became known as an ice pick lobotomy. Though his first transorbital lobotomy was done with an ice pick, Freeman later made his own instrument based on the ice pick's design, the orbitoclast. Lobotomy was widely used in the mid-20th century, when treatments for psychiatric disorders were few, chiefly insulin coma and electroconvulsive therapy, ECT. Lobotomy was typically performed on people with major depressive disorder, obsessive-compulsive disorder, or schizophrenia. The aim of this procedure was to provide relief to people with mental illnesses unresponsive to standard treatment. However, lobotomy had serious risks and unwanted outcomes, such as personality changes, cognitive impairment, apathy, and even death. Lobotomy was eventually abandoned as a treatment for mental illness, as new medications and other therapies emerged. Today, lobotomy is considered a barbaric and unethical practice that violated the human rights of many patients. The Howard Dully Lobotomy Case Study. One of the most poignant case studies illustrating the devastating effects of lobotomy is that of Howard Dully. Born in 1948, Howard Dully underwent a lobotomy at the age of 12 in 1960, a decision made by his stepmother and his father. His stepmother, who found Howard's behavior challenging, sought the intervention of Dr. Walter Freeman, a notorious advocate of lobotomies. Dully's case is particularly tragic as it highlights the misuse of lobotomy as a tool to address behavioral issues in adolescence, emphasizing the lack of ethical considerations and informed consent. The lobotomy left Howard profoundly changed. His emotional and intellectual capacities were severely compromised, and he struggled with a sense of identity as he navigated through life. Howard's experience sheds light on the long-term consequences of the procedure, not only affecting the individual's cognitive functions, but also their ability to form relationships and lead a fulfilling life. His case serves as a stark reminder of the irreversible damage inflicted by lobotomy and the ethical shortcomings surrounding its practice. In later years, Howard Dully became an advocate for mental health awareness, sharing his personal story to raise awareness about the traumatic impact of unnecessary and unethical medical interventions. His resilience and commitment to advocacy contribute to a broader conversation about the ethical responsibilities within the medical community and the enduring impact on individuals who underwent lobotomy procedures during an era marked by misguided medical practices. Devastating effects of lobotomy. Lobotomy, a once prominent psychiatric procedure, inflicted severe and enduring consequences on patients, leaving a trail of devastating effects. One of the most profound outcomes was the loss of personality and emotions. Patients who underwent lobotomy often experienced a numbing of emotions, rendering them emotionally detached and indifferent to life's experiences. The procedure's impact on the frontal lobes, responsible for regulating emotions, led to a profound alteration in the individual's ability to connect with and respond to the world emotionally. Beyond emotional blunting, lobotomy resulted in reduced intelligence and cognitive function. Patients who were once capable of complex thinking and problem-solving found their mental faculties significantly diminished. This decline in cognitive abilities had profound implications for their daily lives, making it challenging to engage in activities that required mental acuity. Additionally, the procedure frequently led to difficulty controlling impulses, amplifying impulsive behaviors that could be detrimental to the individual's well-being. The loss of executive function compounded the challenges faced by those who underwent lobotomy, diminishing their ability to make reasoned decisions and navigate daily life independently. As a consequence, many patients became dependent on others for the most basic aspects of daily living, underscoring the tragic and enduring impact of lobotomy on the individuals subjected to this once widely practiced, yet profoundly misguided, surgical intervention. Lobotomy declined in popularity and usage in the 1950s and 1960s as new medications and therapies emerged for the treatment of mental disorders. The introduction of antipsychotic drugs, such as chlorpromazine in the early 1950s, offered a less invasive and more effective alternative to lobotomy. The development of electroconvulsive therapy, ECT, and psychotherapy also provided other options for patients and doctors. Moreover, the ethical and legal issues surrounding lobotomy, as well as the public outcry and criticism from the medical community, led to the abandonment of the procedure in most countries. Today, lobotomy is considered a historical curiosity and a violation of human rights. Did you enjoy this video? Check out these other clips from Knowledge Matrix and be sure to subscribe and ring the bell to be notified about our latest videos.